Did you know that bowel cancer is more prominent in people who are obese, smokers, and those who drink alcohol and exercise less frequently? It is also found in people who have a family history of bowel cancer at a young age or have other genetic abnormalities. Hence, it is quite important to have early screening. I am Yanez Peerbaccus, gastroenterologist. I will talk to you about bowel cancer, also known as colorectal cancer. What is bowel cancer? Bowel cancer is a form of cancer that can be found in any part of the large intestine. It usually starts as a small lesion known as a polyp anywhere in the bowel and grows slowly over several years to become a cancer. What are the symptoms of bowel cancer? Many patients can be asymptomatic in the early phases where only trace of blood can be noted in the stool. Some can develop iron deficiency, others iron deficiency anemia. Some patients with more advanced disease can have bowel obstructions, diarrhea, bleeding through the rectum, weight loss, and abdominal pain. Can diet affect your risk of bowel cancer? Yes. These days we consume a lot of processed food, fast food, or food which come in packaging, in tins, which have added chemicals and preservatives which will make your risk of bowel cancer higher. Hence, these days we tend to find higher prevalence of bowel cancer. Also, the type of meat that we eat can also influence our risk, such as red meat, fatty food, and oily foods. It would be advisable to eat more fresh foods with less chemicals and salt added to them. This will improve our survival and our chances of not developing bowel cancer on the long term. It is also recommended to eat more fruits and vegetables, hence increase fiber in our diet. How is bowel cancer diagnosed? Most commonly, bowel cancer is diagnosed with a colonoscope, which is a thin tube which is inserted through the back passage to examine the entire large bowel, through which samples of the lesion, that is the cancer, can be taken and sent to the lab for analysis to assess for the aggressivity, the type, and the different grading of the cancer. Other modalities that can be used to evaluate for bowel cancer is a CT scan or an MRI. However, if the lesions are quite small, that is the cancer is small, these lesions can sometimes be missed on these tests. Screening tests such as fecal occult blood is done frequently to screen for patients. However, they do not always equate to bowel cancer, as there are other causes that can cause trace of blood, and they can sometimes miss bowel cancer as well. Hence, the gold standard would be to have a colonoscopy. How is bowel cancer treated? Most commonly, bowel cancer needs to be resected by surgery. The lesion of the bowel that is affecting that particular segment will have to be removed. Many patients will require further treatment with chemotherapy, immunotherapy, or radiotherapy. And in many instances, if the bowel cancer is caught early, it is curative. However, if it cannot be removed or treated completely, there are very good options lately with immunotherapy where patients can live for several years.